joined by my colleague, both Linda Dorman and Yvette Wood. Ladies, how are you doing today?
We're doing very well.
Thank you.
Fantastic. All right, so we are a bit behind schedule, so we do have a lot of time to lot to catch up on here. Let me just say for the next three segments, segment 1, 2, and 3, we're doing a special broadcast report on the COVID-19 situation. We're going to look at it in three different stages. We're going to look at where we are currently, not only in the United States, but where we are globally in our, if you will, fight against this virus. Then we will then also do if you will, a Q&A. This is going to be by the World Health Organization, where they will provide an education, a very in-depth, a deep dive on the various the virus variants, starting from what it was to where we are today. And then we'll have on the third segment, we'll have the third segment will have a focus on the vaccine. Now, for the purpose of today's show, segment 1, my colleagues are going to focus on their guests that they have on the program. We have some healthcare service provider that we're going to have a discussion with. My colleagues are going to have an opportunity to take a look at the particular segment within the healthcare space and this particular organization or institution as it relates to healthcare. And then segment 2 and 3, that's when we'll do our special presentation on the World Health Organization on virus variants and the vaccine. So ladies, lots to talk about, lots happening here, and let's jump right into it and bring our guests in as well. So who do we have, Linda?
We have an amazing panel, because one of the things that we have been talking about when we look at health is women's health. Both Yvette and I know that intimately, the things that women go through as we talk about women's health, but it's so deep and so varied that today, and we're going to have a part 2, I can tell already due to time constraints, 3 women, 2 renowned clinicians, and we also have someone near and dear to this subject of breast health, an advocate, a woman, a mother, someone who goes into the community and as someone experienced, and why it's important for women, particularly women of color, to understand the importance of breastfeeding their baby. So these are not taboo subjects that we're going to talk about, but they're very important subjects for not only women here in the U.S. and in our local community of Prince George's County, which sits in the DMV, as we call it, the District of Columbia, Maryland, Virginia, but those who are listening from other parts and other places around the world. So let's bring them on and let me do an introduction. And I want to spend a little bit of time doing that because it's so critical. So I'm going to go really quickly, but they really are owed the due. So we have Dr. Brianna Walton. She is the medical director of female pelvic medicine and is a board certified urologist, gynecology, female pelvic medicine and reconstructive surgery. That's her board certification. She currently is among the healthcare experts at UN Capital Region Health in Prince George's County, Maryland, which is in the United States, providing critical services to a broad spectrum of women, including those who are underserved and underinsured in our local county. Dr. Walton received her medical degree from the University of Cincinnati College of Medicine in Ohio. And you should love that, Yvette, being from Ohio and Cincinnati specifically. She was invited to be the first fellow of the Division of Urology, Gynecology, and Pelvic Reconstruction Surgery at Harvard Medical School, Mount Auburn Hospital. In the field of robotics, she has personally performed 500 plus pelvic reconstructive surgeries while developing programmatic growth around quality, cost containment, and safety in this practice. She is an active member of the Robotics Steering Committee and was designated as a Center of Excellence in Minimally Invasive Surgery in the year 2013. Dr. Walton was instrumental in the design of the Women's Center for Pelvic Health. In 2017, WCPH received the SCOPE, which is the Safety Certificate in Outpatient Practice Excellence for women's health designation. There are only 2 women's health practices in the state of Maryland in the United States of America, among only 95 in the country, to receive this designation. Dr. Walton, therefore, and it should not come as a surprise, is a renowned and much after sought speaker, lecturer, invited to share her knowledge in these particular areas of pelvic health, regionally and internationally. Also, we have someone dear to my heart, a former wonderful colleague, also at the University of Maryland, or Capital Region Health in Prince George's County, Dr. Stacy Little. Dr. Little currently serves as Vice President for Women's Health and Infant Services and Community and Population Health at Capital Region Health. But prior to joining the healthcare system here, she was the interim Maternal and Child Health Bureau Chief and Director for the Office of Family and Community Health Services in the Maryland Department of Health and Mental Hygiene in the Prevention and Health Promotion Administration, where she led programs that focus on improving women's health, also men, infants, children, and families overall in Maryland. Dr. Little holds a doctorate degree in social work from the University of Pittsburgh, a master's degree in social work from Howard University, a master's of public health degree with a concentration in maternal and child health from the University of Pittsburgh. We are just excited. Dr. Little was also an MCHB doctoral fellow while at the University of Pittsburgh, where she served 2 terms as a commissioned corps officer, student intern, which was the COSTEP program, in the Maternal and Child Health Bureau in the U.S. Department of Health and Human Services. And certainly, last but not least, we are so delighted to welcome to the program Kiana, and I hope I'm saying that correctly, Spencer. She is a local businesswoman here in the DMV, a realtor. But today she comes to us as a wife and a mother of 2 beautiful girls, one of which or both of which may be with us as well on the program. She is a champion and advocate for something remarkably important that we'll do a little bit of a dive into today, breastfeeding and why this is critical to minority health and our new babies as they grow and develop. Welcome, ladies. And of course, I'm just so excited to see my co-host, Yvette, who is our resident clinical as a registered nurse. So let's just hop right into it, if we may. So how's everyone today? And Anthony, you still with us? Okay, great. So thank you, ladies.
I just wanted to make sure that you were all set on your end. I will just say thank you so much for taking the time to be part of the broadcast. The issue of women's health and infant, obviously, it is not exclusive to any one geography or demographic. It's literally a universal issue. So while you hear my colleagues speak about Maryland, the University of Maryland, certainly this discussion is relevant across the spectrum. We broadcast obviously throughout the U.S. on television and obviously on radio. So the discussion, folks, you need to listen here because we're not just talking about the Maryland area. We're talking about an issue that is systemic to women and infants across the board. So I want to thank you for that, and I will be listening to the background and looking forward to the information you're sharing as well.
Okay, thank you, Anthony. We appreciate you. And so why don't we start out with Dr. Walton, because I used a term that it was not as familiar to me as it might be to those of you who understand, and I'm sure I just demoralized it, and that is urogynecology. Now, as someone who is of age, I'd love to understand exactly what is that practice different from gynecology, if there is a practice different.
Can't hear.
So you may need to turn up your speaker.
Oh no.
Well, let's see. We're probably experiencing some technical, but while we're getting that, Dr. Walton, because we have a lot of questions for you, is to see if by chance your computer speaker just needs to be turned up. But Stacy, Dr. Little,
Yes.
I know your background very well, having sat next to you around the system, boardroom and the things that you're doing. here in our county. Can you share with us a little bit of why it's critical that we talk about maternal and women's health, particularly in a county that is predominantly African American and other communities of color around the world that are listening in and viewing in, why this subject is so critical to put into the forefront of our conversation around health disparities in particular?
Absolutely. Can you hear me?
Yes, we can.
So, women of color tend to bear the brunt of health disparities around the world. But particularly as we think about what's happening in the United States, where people think we are so affluent, we have so many resources, how could it be that we have such significant infant mortality here, and particularly among women of color, and particularly among women of actually means, Black women of means, are also experiencing high levels of infant mortality or poor birth outcomes, high comorbidities related to their pregnancies, developing gestational diseases. So it really speaks to the importance of how we care for Black women, how we care for brown women in our country and around the globe, and making sure that we're thinking and being very proactive around the comprehensive care for women. So it's not just it's not just a physical exam a woman needs every year, right? She needs that, okay?
Yes.
She needs that. But she also needs to have the conversation around her lifestyle needs, her nutritional needs, the needs in her mental health, her well-being, the comprehensive care for women, so that when women plan and prepare to have children, they're in the best health that they can be, so that they prepare their bodies, their mind, and their spirit for the bringing of life into the world, and that they can be their best selves, and that child has the best start. So we really, have to think about healthcare very differently, and not just the meet, greet, and treat model. That's not the way forward. It really is a comprehensive approach to healthcare and including women in the conversation as a partner in their health and getting women to think differently about healthcare generally.
Yes. Why do you find, and I know, Dr. Walton, if you're able to plug in, or even, Yvette, because you also see a lot of things bedside in some of your previous practice, why are we having the ongoing continual conversation around health disparities among women and minorities, in particular, women of color? Why is it still a major gap in service delivery or service accessing? What do you think are some of those systemic issues that in our local community we're resolving? And I'm really proud to say that we are in Prince George's County, and particularly where you both are experts and professionals at Capital Region Health. Can you share with us why we're still seeing some of these gaps and what is some of the issues? Nope. Okay. What do you think? One of the things that I have discovered is that we talk about the myths around believing women when they come into the hospital, that there is a real disbelief that women of color can feel pain or have pain. You kind of scratch your head and wonder why. I don't understand why there's still some of the gaps that we are actually experiencing. Yvette, what are you hearing? What are you seeing out there and some of the things that you're working on?
I think some of the disparities, a lot of it is environmental as well, Linda. You look at African-American women, particularly single women who are working, and they're trying to take care of their families. They are taking care of their children. Some are working more than one job, and they just don't take care of themselves. Their health care is thrown to the back burner because everyone else matters. But then they have not learned that self-care is healthcare. And so they tend to neglect themselves. And when they do go to a facility to get help, it's usually not a primary care physician. I'm finding that out here in my practice that most of the women that I see are going to the emergency room as a primary care physician. They don't understand the importance in having a primary care physician. So that's not the first line of protocol that they go to. They will wait until it's really bad and seek emergency room attention rather than do the physicals, the health prevention practices that most of us do. So that's kind of what I'm seeing. And I really am excited to hear from these women, particularly on women's health, breastfeeding, and that whole environmental factor that you're not even taught to breastfeed. I know when I had my daughter, they told me, here's some Similac, here's your baby, and you leave the hospital. It wasn't until my other children that I learned about breastfeeding, which I did breastfeed the last of them, but the first part of the crew did not get breastfed. And then we have the insurance as far as disparity. Women are working and they don't take the health insurance option because they can't afford the money to be missing from their check. They don't understand how important it is to get good health coverage to take care of themselves.
Yes, yes. And so those are very good. Those are real life social determinants. And we'll talk a little bit more about that. Kiana Spencer, am I saying that correctly?
How
are you?
Tina. How are you?
Tina.
Nice to meet
Yes.
you. It's Tina. It's like Tina with a K.
Tina, beautiful. So you had that beautiful baby, and congratulations. So
Thank
tell
you.
us,
Thank you.
as someone who has who's out there champion, why are you engaged in this platform around minority women focusing on breastfeeding their babies?
Well, I myself grew up in Prince George's County, and so I am a recipient of the lack of education on the importance of women's health in general. When it comes to taking care of yourself as the woman, and even providing the best life for your children. Where I grew up, we grew up not eating the best of the healthiest of the foods. The food was good, but it wasn't the healthiest option. Breastfeeding is not something that was ever, enforced where I'm coming from. I have a mother who had twins when I was 10, and that was her first attempt at breastfeeding.
Wow.
So that was the only exposure that I had ever had to it. And thankfully it was at such a, older age, because I was able to allow that to stick with me in my memory. But even that, when I think back on it, she didn't get the support that she needed. So her breastfeeding didn't last very long with them, especially because she had twin boys. So that would have required much support, maybe more than the average mom, because that's a lot of mental feat to take on. So, so just looking at, my circumstances around me, where I've grown up, the people that I know, the friends that I have, I just realized that there was a lack. There was a lack of knowledge. There was a lack of education. There's a lack of support. I know what I wanted to provide my children, and I realized that I had a gift, because while most women may look at it as a chore, it may be something that is very tumultuous, you know what I mean? It just came so naturally to me, like, this is just what it was. Like, it was routine. You get up and you brush your teeth in the morning, right? And you don't think twice about it. So me breastfeeding my children wasn't something that I thought twice about. It wasn't something that I had to feel like I needed to do this big mental marathon for. It was, this is what it's supposed to be, and this is what you're going to do. There's no other option. And because I had that strength in me, I felt that I could provide that support to women, because I feel like for many, not all, but for many, it's just that small mental change that we can make that can make such a big difference. Now, don't get me wrong, breastfeeding is challenging in and of itself.
So let's talk about that.
Mental.
Let's talk about that, and then we want to talk about some of the types of services Dr. Walton provides, because they were quite interesting when I read your background. We want to make sure we touch on the broad services that are offered by someone with your skill set. But can we just figure out, Stacy, Dr. Little, can you tell us a little bit about why there's a challenge there? What are some of those challenges, and what are some of those support services that are being provided by, a renowned healthcare system like the one you work for?
So Kina really outlined it very well. I did a study about 2 years ago looking at some of the facilitators of or mitigators of breastfeeding here in our system with the patients whom we serve.
Mhm.
And it became very apparent to me that the the major issues that the dominant number of women shared was, number one, they don't have histories. They have no one in their family whom they know who's alive right now, who breastfed. They have not seen women breastfeed. Their aunt doesn't breastfeed. Their mother never breastfed. So they don't have this kind of cultural norm or the norm of breastfeeding in their family. That's a big issue. So this whole notion of support, yes, they may have a lot of support, but do you have support in breastfeeding? Because as Shekinah said, when you are breastfeeding, it is, I always call it a labor of love with my children, because yes, it comes natural, but it comes with some challenges, right? So, you have to want to do it. And so if there's some challenges with it because, you're having difficulty pumping, you're having difficulty storing, you're having difficulties with latching on, maybe you're having, it's uncomfortable. The latch on, when it first happens, you're thinking, oh my gosh, is this really happening right now? Your nipples have to get hard, have to toughen up. You have to toughen up in order to feed your baby. And, so all of these things people really don't talk to you about are really important to help women and support them around breastfeeding. And also, and sometimes in relationships, breastfeeding can become a challenge with your partner because your partner sometimes sees you as a sexual being. You are his partner or her partner, but you're also my sex partner, right? And now you are the feeder of my baby. And now that makes you look very different in my eyes. And so those are some of the challenges that come up and some of the reasons why women choose not to, because maybe it's creating rift in the relationship. Maybe the husband or the male partner is feeling jealous because this baby is always on the breast that belongs to me. That could be
But we do know that there is an absolute critical health reason. And I think it's so interesting a conversation because it should be the most natural thing we do. And I know there's a lot of assumption there. I had an assumption that women who didn't breastfeed was because of some medical requirement or some medical issue versus those who did, because it's such a natural segue from your birth to your breastfeed because of the nutrients, because it's natural. But we're finding that society has allowed for us to not proceed on that natural track for many, many reasons, as you're naming. Right. Real talk. Real talk.
There's some real, we have to be honest. I think part of the challenge is that we have a tendency to not tell people the whole story, right? So what I think as women, we need to have table conversations where they really get to hear some of the challenges, but the benefits to your baby. Your baby has less allergies. Your baby has less sickness and illness. Your baby has better digestion. Your baby, why would you want to give your baby chemicals when you can give your baby natural breast milk? If you can. For some women, they do have challenges and they can't breastfeed. So it's not to shame those who can, but when you can, let's support you with every ounce of our being and wrap around our arms on women so that they can feel like they have the support they need, the people who've done it before, people who can give them, valid testimony, and not people who are just saying breastfeed because it's good for your baby, because that really doesn't meet the mark.
Excellent.
Absolutely.
Yeah, that's a good distinction and a critical piece to understand as we proceed. And I think that even if we're supporting a woman who's pregnant, when is the breastfeeding knowledge transferred? After the baby's born, or is this part of the prenatal education that goes into healthy baby living that we need to, when we see a woman, and we have mothers, I'm a mother of teenagers, but if I see a woman who's pregnant, I want to be in a position as well as join Ms. Spencer in terms of advocating to say, I hope you're going to breastfeed, and this is the reason why, and if not, then perhaps you need to get more information because there's a whole critical piece that you may not be aware of in the breastfeeding, particularly as a woman of color.
Absolutely. Dr. Little, can I ask a question? We were talking about support for breastfeeding mothers. Can we talk just for a brief moment? I know we're kind of pressed for time, about the taboo, so to speak, of breastfeeding in the African American communities. I know for me, I was not allowed to breastfeed at a family gathering, or I was asked to leave the sanctuary. We were not allowed to breastfeed in public, even though you have all these breastfeeding areas and you're allowed to pump in a certain room now. Your job has to allow you to do that. It is still not widely accepted in the African American community. Sometimes when you're around your friends or family, they tend to shy away from you breastfeeding your family, your baby in front of them. And that tends to cause people not to want to breastfeed because they feel like they're being exiled. So can we talk about what kind of support we are offering these mothers coming into that, knowing that they're going to be looked upon a little differently for breastfeeding in certain communities?
Yeah, I mean, I think part of it is that there aren't a lot of people who look like them who breastfeed. That's part of the challenge. And we're even seeing that with new immigrant women, second generation. The new immigrant, yes, but their children, not so much. And partly that may have to do with the fact that, some families or some individuals are hourly wage workers and they're having some challenges around that. I think in other cultures and ethnicities, people are more breastfeeding is more commonplace kind of generationally. I think in the US, where, we have African Americans, there was a whole period in our culture where Similac and I won't let me not say the names of formula was pushed among, for people of color to use because of the nutritional value felt that formula had, the belief that perhaps these communities are undernourished because of food deserts, because of lack of appropriate nutrition. So let's provide their babies with appropriate nutrition in way of a formula, right? But that was one solution. But what came as a result of that is this whole generation of women, Black women in America who think breastfeeding is, breastfeeding is for poor people. Breastfeeding is for people who don't have access to formula. Breastfeeding is not yes, it's the best nutrition. They know it's the best way to feed your baby, but it's not that convenient. It's all of these challenges that it really is going to require us as a community to re-educate women. That's what needs to happen.
Well, that's critical. And, we're going to definitely have the second part of this particular broadcast because really focus on a lot of, Dr. Walton, what you are doing here in our local healthcare community and what you have been able to communicate internationally and regionally in terms of your expertise in this particular area of women's health, the urogynecology and pelvic health. And I'm so proud of myself that I said that word correctly on that try. Good job, Linda. Because it is broad and deep. And I think it's critical because it goes from young women all the way up to those who are menopausal, something that we had conversation around incontinence, because there's a lot of taboo subjects in women's health and we have to just plow right through them because there's resources to support and help. And I know that that's one of many that through your services can be addressed. And we don't have to live with some of these healthcare issues that we've accepted as norm because it's a taboo subject. So I think we're going to be heading off to commercial and then we will come right back with this wonderful conversation. We thank you.
Small business is a part of all of us each and every day. It's where we eat, it's where we shop, it's where we go to meet our friends and colleagues. In the wake of COVID-19, our small business community desperately needs our help. We must do our part to help our local communities to once again thrive. We must focus our attention on the small businesses that are the fabric of our great nation. SureUp is a network of small business owners, their employees, and local consumers all working in unison to support each other. By creating incentives for consumers to think local before considering regional and national providers to fulfill their needs, we create local job opportunities and rebuild our communities. In addition, through AI-driven tools and machine learning, in just 5 minutes a day, SureUp assists business owners in improving their social media presence, which enhances their visibility among consumers and levels the playing field so that local businesses can better compete with large, name-brand online competitors. When local businesses leverage the SureUp platform, full-time and part-time employees, whether W-2 or 1099, are rewarded with a variety of voluntary perks and member benefit options. These include discounts on the things people do every day, access to low-cost, subscription-based telehealth and teletherapy, discounted prescription drug plans, connection to exclusive Prosper resources, and so much more. All for less than the cost of a cup of coffee each day. The Jumpstart Marketplace is here to support the health and wellness of individual employees, as well as the health of businesses in the local communities in which we live and work. We're all in this together, so join us as we reinvigorate our local community and improve the physical and financial health of working America.
Right now, 91 million Americans are financially overlooked. 48% have a fear of finance. 2 in 3 lack the ability to manage their finances. We solve this issue by combining financial literacy and financial management into one seamless app. 1. Have your financial goals align with your values. 2. Track your money and forecast how big decisions will impact your virtual accounts. 3. Build financial literacy at your own pace. Our competitors are rigid, disconnected, and impersonal. They represent the old way of doing finance. That's not who we are. We personalize your finances for you because we know one size does not fit all. We're democratizing personal finance. Join the tribe at Core Finance and
Wonderful. So are we all connected, which is so great?
So. How about now? Can you hear me?
We can. Outstanding. Outstanding.
Listen, I can reconstruct a vagina, but I can't operate this darn system. So don't
Well,
judge
we're
me
glad
by
that
my
you're-
skill sets here.
Well, you know something? We're glad that you have that skill set, because that is something that I know that I have never even attempted to do, but I have one. And so because I have one, and we are all women that have them, and women who are listening, we just have to jump into that part of the conversation. And let's do that, Dr. Walton, because we appreciate you and we appreciate Dr. Little being with us to talk about women's health. So I know at Capital Region Health, you're with the Capital Region Health Medical Group. And that's a new program down in our National Harbor, right here in the state of Maryland, in Prince George's County. But you're building a unique and multidisciplinary program that combines your medical and surgical expertise for the treatment of pelvic floor disorders. And
Right.
how, for the layperson like myself, even though I'm a woman, can you give us a rundown of what that means? What are some of those disorders, and how are you building this innovative practice, multidisciplinary practice here that others may need to access where they live and work?
Okay, so I'm gonna do right brain, left brain. And right brain is saying if it drips or it drops, I'm your girl. But the left brain is basically saying if you have problems with urinary incontinence, you leak when you laugh, cough, or sneeze, or you can't make it to the bathroom, or you're crossing your legs, or you find yourself always mapping for restrooms, I'm the person you would probably see. If you are having problems with your pelvic organs sort of protruding in places and spaces, or you don't feel the same that like you used to after you had your baby, if you're having problems with recurrent urinary tract infections, or if you're having painful intercourse, all of those sort of fall in my wheelhouse. Most people come with me with sort of vague complaints or sort of being at their wits' end. And even though I know you were having a little issue with urogynecology, I will tell you there are plenty of my work colleagues who have asked me, well, how is a European gynecologist different than a United? So even they don't know.
Well, I don't feel so bad now, because now that's going to be my practice, urogynecology, because that is so. So with that said, is there a certain line of treatment that you as a urogynecologist would differ from I don't want to say regular, but my regular gynecologist?
So I think of our gynecology colleagues, we kind of co-manage patients for the maintenance of your GYN health, pap smears, screening for infections of the vagina, helping you with abnormal bleeding. That tends to fall in their wheelhouse. Whereas I kind of bring together those other two compartments. I mean, the pelvis contains more than just our genitals. It contains the bladder, it contains the colon. And so from that standpoint, many women will be experiencing things such as constipation and straining that they don't really understand why they're doing it. They just know that they have these sort of surrogate mechanisms to manage their symptoms, when in fact it could be a pelvic floor disorder. Or you could have the patient who's gone to their GYN several times and said, you know, I keep getting these infections, but every time they take the test is negative. Well, there are certain aspects of urogynecology that we do special testing, that we look at the health and the status of the vagina to say maybe it's this and not what you traditionally thought. So we kind of look at things with a little bit of a different vantage point, but it's complementary and not competitive.
And you know, this is such fortuitive, because Yvette and I have talked about hosting a program, a show. What did we talk about on sexual health and women's health and sexual health? I think that's what we said, right? And so it to be able to draw out a lot of the myths and a lot of the misinformation, the disinformation, so that women can actually enjoy their lives and not have to be accepting of things that they don't want to talk about, and maybe not even talk about with their healthcare provider. And so, you know, one of the things that I know you treat is something that I feel blessed that I don't have that experience, but I know others who have, and that is bowel leak. Like urine leak, which would be incontinent, correct? And how would you fix something along those lines? My goodness.
So let me back up, because I want to compliment Tina because she said a lot of things that resonated with me, and I was trying to shake my head and say amen. It was like I'm being at church, not on a medical show. But the key is a lot of our community has not necessarily normalized the issues that we deal with. And so the key is to begin to talk about these things more openly. Now, you can pull out a breast and have a conversation about it, and that's okay. But when you start talking about bowel leakage, nobody wants to talk about it because it's not just embarrassing, it's mortifying. And even more so, what I hear from women sometimes is even just not being able to control their gas. So they end up not going to church, not participating in activities, not doing exercises. And so it takes away not only their mental health, their spiritual health, but then their physical health. So part of it is just trying to figure out, is it an anatomic problem? Is it a neurologic issue? Is it related to a pregnancy? Is it more so corresponding with a lower back problem? And that's why for us, when we see people for our very first visit, it takes me a little bit to kind of dig through all of those details to try to get a comprehensive, holistic picture, as opposed to just saying, oh, I'm looking at one organ and trying to understand that one little area. I want to understand that whole person.
Well, I don't want to disconnect from Ms. Spencer, because when we talk about breast health, one of the things that I understood is that it really helps to exercise or restore the uterus as part of your pelvic health going forward. So there's a connection, and wanted to find out is, what your experience was that Ms. Spencer and, all the other moms that have breastfed on the panel, but specifically because it looks like you're the newest mom of the group here. And so, I don't want to disconnect. I want to bring you into that general conversation, because that's kind of what I've heard is one of the key reasons I want to push back my belly fat and my abdomen and get back to my pre-weight or pre-pregnancy figure. Is that a myth, or is that actually true? And is that something you experienced, Ms. Spencer? So that's a question for both Dr. Walton as well as Ms. Spencer.
Well, I'll go Dr. Walton if you don't mind. I would say on the non-medical side, on the societal side, I think that it's a myth that breastfeeding is going to hinder your ability to snap back, so they say. It's actually the reverse. What I found, what I've been advised, what I've read, everything that I have come across, breastfeeding is actually going to catapult you into getting back to your pre-pregnancy body quicker than not breastfeeding. A lot of people don't understand the science of breastfeeding and how your uterus is contracting and actually getting smaller as you're breastfeeding. And I know that it seems like I'm a new mom, but I actually have a 4-year-old. And believe it or not, she breastfed until she was well into 3 years old. And I would say that, and Dr. Little can tell you, she's seen me from before having the baby to after having the baby. And even with this one, I would say that breastfeeding is what got me back to my pre-pregnancy size. Now, everyone's different. Everyone is different. And some of us, we, may gain weight in certain areas more than others. And so those types of issues are a you issue. And that's something that you would have to, work on. And I'm honest. I like to be transparent because I think transparency helps moms when they're trying to go on their journey. So my issue is always my abdomen. It runs in my family. My issue is my abdomen. So, the breastfeeding helps me with that area, but then I still have to do additional work. But what I will say is this: a lot of moms, they try to rush into doing, all of the working out and getting back to their pre-pregnancy bodies and not giving themselves grace, not really understanding that you just brought a whole life into this world. Like you're like a superwoman right now. It took you 9 months to breed a human being. Think about it. All of us came from a mom. All of us grew in another woman's womb. Think about the greatness in that. It takes time for you to
That is fabulous.
bounce back. You know what I mean? And you should give yourself grace. You should give yourself time. but you can totally hop in the gym. You can, so for me, yoga is my piece. And it really helps me. And I know that we're centralizing our conversation in certain directions, but moms, they suffer from different things when they, have children. Like, I don't know if I'm saying the word correctly, but diastasis.
Well, let's see. What tell us about that, Dr. Walton? We have probably about 5 minutes left.
And
I mean, she's going to be your new. Yes, she's got a broad. Which means to tell you that
you're good at your job. So thank you. That was such a good summary and segue. If you don't mind, then I think part of what you were talking about too, in terms of, okay, let's just use some of the science behind it. When you breastfeed, you release a hormone from the brain called oxytocin. It causes the uterus to contract. It is also the hormone that when women spend time together is released and enhances our bonding. That's why sisterhood and sharing is so important. And when you're a mom, you don't want to isolate yourself because you continually release those hormones. I think the other piece of it, when you breastfeed, you have a different mindset. I have to eat healthier to help my baby. I have to watch what I put in myself so that what comes out is also healthy. And so perhaps some of the weight changes are also informed by doing that. The other piece of the puzzle that you mentioned that I think is equally as important is giving your great self grace and mercy and not trying to jump back into CrossFit or some high impact exercise program right away, because as your body is starting to compensate and recalibrate hormones, because as you breastfeed, you do not generally have a menstrual period. And so some of those ovarian hormones are turned down, and many of them contribute to collagen formation and making your tissue stronger. So as we're revving up on those hormones, you need to take it easy. Yoga is a perfect way to kind of re-enter it, because you're doing more isometric exercises where you're focused on not on your pelvic floor, but your core. And then I always laugh and say the back door. So you have to have sort of a sort of symbiosis between all three in order to have a stable environment. And with the diastasis, or the separation of the muscles, so the 6-pack is actually, a 12-pack or whatever pack. Because of that gap, you're bearing weight differently. And so some women will experience more back pain, discomfort, especially if they're carrying their baby on one side all the time.
Wow. So one of the things I want to make sure that we bring into the conversation is something that we don't normally get introduced to very briefly as our time is coming down, and that is the robotic, the innovation, the introduction of technology into the surgeries that you perform. Can you give us kind of a top level of some of the surgeries you perform that, may help us as a woman, and how you incorporate technology into that?
Sure. So I think robotics should be thought about as a tool. From an access standpoint, many of us are used to or heard about moms and grandmoms having a hysterectomy through a large incision, like a cesarean section incision. But we know moms need to get back to activities. We know that from the standpoint of safety, if we make a smaller incision, the recovery process is shorter. And with robotic access, we can generally cut down on the amount of bleeding, which is a key problem with a larger incision. So it not only robotics does it allow us more wristed actions with our instruments, more like our hands instead of sticks that we use with laparoscopics. It also doubles our visualization because it's 3-dimensional and not 2-dimensional.
Oh, okay.
That's
Wow. Awesome. That is remarkable. I mean, there's so many more questions than I have. You have no idea. And I have just completely I know Yvette has her questions too, but I've just hogged all the questions on this particular session. And Yvette is our clinical co-host. She's our RN, always comes with an amazing perspective that we can get into shop talk. But the presence of Anthony means that we are just about, if not out of time. And we want to make sure that you and others who are listening and viewing in can stay with us for segment 2 and segment 3 to talk about this thing, this pandemic, this global pandemic. Really, really, really critical. The World Health Organization Q&A.
Certainly, we need to do a follow-up with our guests, have them back at their convenience to be able to have a follow-up on this discussion. And so I want to thank you ladies for being part of the Marketplace Show Reset, and look forward to your return to the program.
We thank you all and have a great afternoon. We look forward to figuring out a time in which we can bring the panel back together and continue our conversation on women's health.
Thank you so much.
Absolutely. Thank you.
Thank
Bye-bye.
you very, very much.